What I'd like to do is to introduce our first speaker tonight. And most of us know Lucy Brogden because she's the wife of John Brogden, who is famously the leader of the Liberal Party in New South Wales, and many believe destined to become Premier of the state. But Lucy's very successful in her own right as a businesswoman. She's a National Mental Health Commissioner. She's also Patron of Partners in Depression and Lifeline on the Northern Beaches, and I'd love you to join me in please welcoming Lucy Brogden to say a few words.
Thanks, Tony, and thanks, Natasha. Before I begin, I would like to acknowledge the traditional owners of the land where we are tonight, the Gadigal people, the Eora Nation. In the last few years, particularly as a mental health commissioner, I've really come to spend quite a bit of time with some amazing First Australians, and we have so much to learn from them around community, connection to country, and the power that has on our well-being. And I'm grateful for the lessons that I'm learning from them every day. I'd also like to acknowledge those of you here with a lived experience of mental illness. As Tony said, it's sadly not an exclusive club to be a member of, but it's a journey that we travel. And also those people that are the carers or the loved ones of someone with a mental illness. Together we run on a very rough path, but the rewards generally outweigh the hardships, and there's some very special power that comes from a combined partnership like that. The other thing I'd like to put out is just a little health warning. As a mental health professional, I know that conversations like the one we'll be having tonight can sometimes stir up stuff for all of us. I know personally telling my story can be quite draining and very emotional. And if it does affect you in some way, there are people here that you can talk to that are happy to provide love and support, but also, if there's nowhere else you feel you can turn, remember that there always is Lifeline 13, 11, 14. And I say that not just as the patron of Lifeline, but as a real supporter of the great work that they do. It's been such a great honour to be able to work with Natasha and to get to know her as being a real gift that we both believe the universe somehow planned for us to be connected in this way. And I do wear many hats when I talk to you tonight as a mental health commissioner on the National Commission, Patron of Partners in Depression, really trying to provide great support to those who love and care for someone with depression in the community. It's a peer support program that's proving to be terribly effective, involved with Lifeline, and also a Friend for Carers New South Wales. And the golden rule on caring for anyone is your own self-care, and I think that's an important message that will probably come out tonight as we talk a little bit more. But also got a new hat, and that's Friend of Natasha, and I'm so proud to be able to support this book and the launch of the book and the message and the work that she's trying to do. So as the Mental Health Commissioner, I can tell you that we spend $10 billion a year on mental illness. And I'm not a mind reader, but I can guess that most of you are thinking, I don't see it, where does it go? Sadly, the majority of the money that we do spend on mental illness is going in disability support pensions and carer pensions. Now, they're great safety nets and we need them as a society, but I think what they also are is a real indicator to us that the system's wrong. But we're dealing with people at the crisis end and not at the prevention and community support end. And that's one of the key objectives of the work at the Commission and a number of passionate people working in mental health to shift the focus down to the community, to early intervention and work with people before it gets to that crisis phase. People's needs do vary dramatically across the spectrum, and we've heard the statistics around the proportions of people, but we're talking about 3.7 million Australians. It's a lot of people that are struggling and suffering. And of those, 65,000 we put in the severe and persistent end. Again, a lot of people, a lot of families being called on to provide a lot of support and a lot of distress. I can tell you about the economics and the power of it, and it's interesting in a week where we've had so much discussion around tax reform, health funding reform, education reform, that on our modelling and our indications, if we actually worked better at addressing the mental health issues in our community, we could have a bigger impact on GDP than we would have on tax reform. But tax reform's kind of easy, mental health in the community, much harder issue. But these are all dry, big numbers that are really hard to often get your heads around. Sometimes I liken it to climate change, where we look at these big issues and really find it hard to know what we can do as individuals in the society. And that's where at the Mental Health Commission we've adopted a model that an amazing lady called Janet Ma proposed, and that's the Contributing Life framework. And I think if you're struggling for a philosophy around how to make mental health better in this country or even through to your communities, the Contributing Life framework for us informs the decisions that we take, the recommendations that we make. And it really lies in the essence of a fulfilling life, enriched with close connections to family and friends, experiencing good physical health, well-being, and allowing those connections that we have to be enjoyed. We know that people that are living and struggling with mental illness often become isolated from friends and family, but that's an important part to their recovery journey. It means having something meaningful to do each day. It doesn't necessarily mean going back to work full time, but it means maybe volunteering or participating in a learning activity. And I was speaking with some people earlier, and one of the tragedies around mental illness is, particularly in our young people, they can often get marginalised out of the education system, and that becomes a sentence in and of itself, that they find it very hard to get back into education and then move on to employment. And while they don't want to carry that label and stigma, the circumstances almost put that label and stigma onto them unwittingly. It means also keeping people safe from suicide, and that's really the tragic end of the mental health question. To put clarity on that, you may be aware that the ABS reported the suicide numbers just last week, or 2 weeks ago, and those numbers are up for 2014, which is the last reporting period. They're up across the board. Just over 2,800 people in 2014 died by suicide in Australia. It's more than the road toll. It's more than 7 people a day who are feeling grief, pain, loss, and trying to work out how to move forward. Families that are struggling to pick up the pieces. And Natasha's been there, and I'm sure a number of people in this room have been there trying to make sense of the world. The numbers are up across the board, but they're up particularly in groups where people may not focus on the data. We talk a lot about young people and suicide, but the highest rate of suicide in our country is in men over 85. And there's a lot of complexity in there in terms of what we might do around suicide prevention. But it's also going up for men in the age groups from 35 to 49, another vulnerable group. Our young people are represented in the data. And I find that I'm really torn when I talk about data that it dehumanises, that we take people away from it. And so I try to put the face to the numbers as we talk about it and work with it. And it's wonderful that we've got Jack Heath here tonight from Sane Australia and the great work that they're doing around stigma and trying to reduce stigma. But if we go back 2,000 years and even earlier, the ancient Egyptians talked about mental illness, and we have records of that. Hippocrates identified the humours, and he wasn't far off the mark in trying to understand the chemistry of what was going on. Not long after Hippocrates, we had Plato talking about mental illness, and he made a profound statement that is as relevant back then as it is today. Plato said that the greatest mistake physicians make is that they attempt to cure the body without attempting to cure the mind, yet the mind and the body are one and should not be treated separately. And I think that goes to the heart of so many of the treatment issues that we're struggling with at the moment. We know that sadly people with a mental illness will suffer a number of other physical issues that are often left untreated. And at the Commission, that's one of our key projects going forward, is to raise the awareness of looking after the physical health of someone with a mental illness as well as their mental illness. But rather than dwelling too much on the past, which can be depressing in and of itself, and trying to remain positive and persistent in the arguments that we need to propound and put forward around policy change at all levels of government, I take my inspiration from a great man called, from the UK, William Wilberforce. And if you don't know about William Wilberforce, then spend some time learning about him. He must get the prize for persistence when it comes to public policy. He was the advocate for the legislation in the UK to abolish slavery. It took him 20 years from the introduction of his first bill to actually getting that bill through the House of Commons in the UK. So whenever I feel like I'm in an episode of Yes Minister, which is quite regularly, I just have a little look at William Wilberforce's quotes and I'm spurred on to action. And one of the key message that he had when he would go out speaking around this issue that to us just seems like such a no-brainer was he said that you may choose to look away, but you can never again say that you did not know. And I think that actually feeds in nicely to this book, Marrying Bipolar, and Natasha's great work. And it really is a truly beautiful read, and it's amazing the number of people that have read it that say I read it in one sitting. I sat down to flick through and couldn't put it down till I finished the book. Natasha's really shining a light on a very important topic. And if you really take nothing more from the book, having read it, you cannot say that you did not know, and I think that's really important. So congratulations, Natasha, for the courage to put the pen to paper or the fingers on the keyboard. Telling a story is really tricky for some of us, easier for others, but it does take some courage to put yourself out there, to put your story out there. And not so long ago I was at another event and people were talking about the power of storytelling, and again that's something that we can learn from the first people in Australia is their power of storytelling for healing. And I started to look at the power of the story in terms of how it helps us and how it helps community. And I like to quote other people because they generally have much better ideas, but I love Doris Lessing's writings, and Doris Lessing's a Nobel laureate for her writing, and she said that the storyteller is deep inside every one of us. The story maker is always with us. The storyteller will be there, for it is our stories that will recreate us when we are torn, hurt, even destroyed. It is the storyteller, the dream maker, the myth maker that is our phoenix, that represents us at our best and at our most creative. And there's so much of that phoenix-like story that comes through in Natasha's book, of the understanding and the growth and the battles and the torments that she went through. Somehow that the universe, as I said, knew that Natasha and I were meant to meet. We have similar stories but different stories, and in connecting together we've been able to I think help each other understand this complex issue a little bit more. Natasha talks about her journey with her husband with his bipolar. I talk about my husband's journey living with depression. And we talk openly about the impact on us as spouses, as partners, as friends. We talk about the impact on our friends and family because it's not always easy to cancel plans at the last minute, make up excuses, try and work out what's going on. It can be quite disruptive. But we also talk about the really good times, and there are really good times, and I think that's the positive message that comes through from this book, is that it can be hard work, but there's a lot of love and there's a lot of fun that can be part of the journey. Natasha does this really so thoughtfully that we have some great insight into bipolar, and it's such an enigma what goes on, and I think that the sharing that Natasha's done helps us to understand more what, in a medical sense is very complex, but the behaviours that can go with that, the ups and downs, the highs, the lows, the struggles for treatment, the struggles for recognition, diagnosis, are all touched on. But the two of us have very different outcomes in our lives around mental illness. There are two Johns in our world, my husband and her husband. And both of them reached, in a very strange coincidence, a very, very dark place on exactly the same day, nearly 10 years ago. It is, obviously, in this coincidence, difficult to ignore the what-ifs. But I think the two of us have learnt a lot about ourselves over the last 10 years, and I think we've both recognised that we're very strong women, and that we've really got something special now inside of us that we want to share in the different ways that we can. But what I do know is that as a professional and as a carer, I have seen that with the right treatment, the right support, many people can and do go on to make a full recovery and to lead that contributing life. But to use someone else's phrase, that does take a village. Sometimes it can't just be us on our own trying to be the whole treatment course. We need to reach out to others to provide that support. And the treatment is not just about medication, and I think that's something that we need to remind ourselves. There's good self-care, there's looking after sleep, diet, exercise, all sorts of things really come to bring our lives back into balance. as does connections with family and friends. And for those of you that are caring or friends with someone with a mental illness, please work hard to maintain that connection with people. The isolation can be really a debilitating part of the illness, and it's really up to us to be the ones reaching out. The first step of any recovery journey is acknowledging the issue and getting help. And if you are worried about someone, the best thing, the absolute best thing, and backed by evidence, is to actually ask that person. More than just, are they okay? And don't be scared of asking them if they're okay. Don't be scared of the answer. There are tools out there that can help you manage that answer. But stay with them, stay connected with them, help them get to a GP, help them get the information they need, and help them on that journey. But please just ask them if they are okay. And remember that if they don't want to get help, that's not your fault. You're there to provide guidance, you're not there to fix people. It's one of the interesting things about particularly mood disorders and taking that through to bipolar is that the first thing to go for a lot of people is their self-awareness. And so that's where we often struggle with looking on and saying, can't they realise they're not happy? Don't they realise this is not good stuff? Well, no, they don't. And I tell this story with a lot of humour that when I did go to see my husband in the hospital after his suicide attempt, he said to me, oh, you know what, there's this thing called self-awareness. I was like, yeah. He goes, I haven't got any. Yeah, that's why you're here. And until he had really built up some of that, he was going to stay there for, what transpired to be around a month. But self-awareness is something that goes, and that's where we can be that mirror to people, to help them see what they're not seeing. But we need to be gentle and thoughtful and kind about that, not just dogmatic and expect them to respond straight away. So reading Natasha's book, I think, will give you some of that insight that it's not an easy journey, but that there are many rewards to it. But there's also hardship and pain, and she balances that really well. And that's what I love about the cover too, is you can look at that cover either as a downward spiral or an upward spiral with stairs coming out of the abyss. And I would encourage you to look at the latter, that this is the stairs that bring you up out of the darkness to the light. And, being from a political family, I guess I need to finish on a political quote. And there's someone that doesn't get much good press for his political quotes, but Richard Nixon, when he was at his darkest hour and being hounded out of office, said that it's not actually till you've been in the darkest valley that you can truly appreciate what it is to stand on the tallest mountain. And I think tonight Natasha's reached the top of that mountain, so congratulations.